you for joining us today. We're going to start now, but before we begin, we'd like to begin by recognizing that wherever in North America and the Caribbean we are logging in from today, we are located on the traditional territory of Indigenous peoples dating back time immemorial. We acknowledge these lands, the people, and the treaties in place in North America because the first step to reconciliation is recognizing the first peoples of our lands and our relationships and mutual responsibilities. Hundreds of years after the first treaties were signed, these treaties are still in practice today. The power and potential of land acknowledgement allow us to connect with the very rich history of these regions and make it clear that there were first peoples who lived on these lands prior to the forced transportation and subsequent enslavement of continental Africans and the related arrival of European settlers. We acknowledge the importance of working in stewardship with Indigenous peoples to manage these lands with respect for Indigenous customs and ways. I am based in Hamilton, Ontario, on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. And I encourage everybody to add where you're joining us from in the chat as well. Charles, on to you.
Thank you, MC. Good evening, everyone. We acknowledge those who have gone before us. Over centuries, over generations, our African ancestors arrived on Canada's shores and through Canada's ports, some involuntarily and others willingly. Peoples of African descent and continental Africans, as enslaved peoples, as displaced peoples across Africa's diaspora, and as migrants, we have survived. Collectively, we have made an indelible mark. Despite the horrors of the transatlantic slave trade and over 400 years of enslavement, peoples of African descent have contributed to Canada's rich cultural and economic history. We have thrived. In solidarity, as members of Canada's African, Caribbean, and Black communities, we fight against the impact and effects of structural and institutional racism that African continental and diasporic peoples face every day. In so doing, as African descendants, we honor our African ancestors regardless of origin. Thank you.
Good evening, everyone. My name is Patricia Gongol, and I'm the Executive Director of the Canadian Donation and Transplantation Research Program, a CDTRP based at the University of Alberta here in Edmonton. And I'm a settler on Treaty 6 territory, the traditional lands of the Nehiyaw, Niitsitapi, Métis, Nakota, Dene, Haudenosaunee, and Anishinaabe. So thank you, Mary Claire, for delivering the land acknowledgement. Mary Claire is CDTRP's program coordinator, specializing in communications and knowledge mobilization. And thank you, Charles, for delivering the African ancestral recognition, which was written by Dr. Jacqueline Getfield. Charles is an active member of CDTRP and an experienced patient partner in health research, lending his experience and perspectives to improve the quality of research and health outcomes for people. So on behalf of CDTRP, thank you for joining us today for the third session in our series, Conversations about Health in Black Communities, Family Past, Family Future. Thank you very much to Anoush and Kael, who are going to be sharing their story with us today. Before we begin, I want to tell you first a little bit about CDTRP and why we're partnering with QARM to ensure African, Caribbean, and Black voices are engaged in CDTRP's work. So CDTRP is a national research network, now in its 12th year, committed to improving both living and deceased organ donation and the long-term health of transplant recipients across Canada. We support donation and transplant research by working in partnership with people with lived experience and communities to understand their priorities and co-develop health research and information that matters to them. And one of the goals through our partnership with QARM is to build partnerships with patients, families, living donors, deceased donor families, caregivers, individuals with chronic health conditions, and community-based organizations. Together, we aim to work with you, those on the call today, to hear about the needs and experiences of African, Black, and Caribbean Canadians who rely on or may one day rely on donation and transplantation services. So at CDTRP, our patient, family, and donor partnerships platform is dedicated to ensuring that the voices and priorities of PFD partners are meaningfully integrated into the research projects and into our network activities. And we're very proud to have over 100 partners representing about 25% of our total membership. And we recognize that their involvement, your involvement, is essential to co-developing research that really matters. And there's a lot more we can do to incorporate voices with diverse experiences and earn the title of ally in this work. So our team, Charles, Manuel Escoto, and Dr. Jacqueline Getfield, have developed a patient, family, donor research advisory group focused on the priorities of African, Caribbean, and Black communities. And so we've had 2 meetings to date from this group. And invite all of you to join us and then share your insights and leaderships if you're interested in continuing these conversations as a part of that group. So if you're interested in getting involved in that, just let us know in the chat or complete the survey at the end of the session and let us know that, and we can follow up with you. So now an introduction from Carm. So Istvan, over to you.
Good evening, everybody. Thank you very much for having us here. I'm not talking from outer space. As it appears on the screen, I'm actually currently in Milwaukee at a conference, and together with Dr. Getfield, I'm representing CARM here. CARM is Caribbean African Regenerative Medicine program that we started a few years ago, but this has a longer set of foundational work that had been done over the last 10 years. I'm a transplant nephrologist at the University Health Network in Toronto. Work with patients who need a kidney transplant and also work with patients who had a kidney transplant. And when I started this work at the Toronto General Hospital in 2014, one of the research programs that we started to build was to see how living kidney donation, living donor kidney transplant is being accessed. Is it accessible for everybody who needs it or not? And the first, it started out as looking at our data that patients who were transplanted at the University Health Network, and we found that amongst others, Black patients had much less chance to get a living donor kidney transplant, which we think that from a medical perspective is the best treatment for kidney failure. And from that, we started to look into this more deeply. And in 2019, in partnership with a number of researchers, both in Toronto and in Vancouver, but also importantly with the Black Health Alliance, we conducted a project called Action Project that we tried to understand the perspective of diverse Black communities about kidney health, kidney transplant, and what we learned through this process that we cannot really understand kidney health and kidney transplant in these communities without looking at broader issues and access to health and relationship with healthcare in general. And from that project, we were able to start the CARM, the Caribbean African Regenerative Medicine Project, in 2022. This was funded by a research program at the University of Toronto initially. And this is when we first met with Dr. Getfield, who has become the project manager for the program and has been working with us since. Throughout this journey, we learned a lot about how diverse Black communities look at kidney health, healthcare, health and wellness overall, started to understand what the needs are, and hope to bring this back to the research and clinical communities to inform them about those needs that are very frequently not met in a clinical setting in Canada today. So that's our long-term plan, to build this dialogue between patients, communities, and the research and clinical communities, and talk about different aspects of health and healthcare and treatment options, and support the communities to to choose the best ones. So in this work, as I mentioned, Dr. Getfield's contribution has been quite essential. This program is co-led by Professor Carl James, who is a sociologist at York University, and he has been the co-lead of the CARM project, but Dr. Getfield has been really the motor and the heart of our work, I would say. Importantly, in addition to research and initiating the dialogue, we wanted to also bring in students and young people into this field. And basically, in the last 2 years, with the work of Dr. Getfield, we have now about 20 students from diverse Black communities who are either in medical school or heading towards medical school or medical research. So Dr. Gatfield, who will introduce this webinar and who will be interviewing our patient partner today, is a researcher, a qualitative researcher who graduated, did her studies both back in Jamaica and also graduated from Ryerson. She has a very diverse experience in communication, marketing, public relations, in corporate and increasingly academic setting. And her research, she did her PhD just a few years ago, and her research is focusing on mothering and disability and Blackness as it manifests itself in current Canadian environment. And she has been the mentor of many of our students, and I welcome her today, and I pass the microphone on.
Thanks, Iswan. Thanks, everyone, for attending today's webinar. Tonight is the third in a series, and the series is titled Conversations About Health in Black Communities. So, welcome, welcome, welcome. Let me tell you, you are in for a treat tonight. Tonight's session is titled Family History, Family Future. And at the end of it, you're going to get a test. Yes, that's what we professors do. And you're going to tell me why. Why is it titled Family History, Family Future? But first, let me say how wonderful it is to be speaking with Anoush and Kael tonight. Let me first introduce them. Kwameah Anoush Bennett is a dedicated childcare leader, a mother, and an advocate. A registered early childhood educator with over 30 years in the field. She currently serves as the executive director of a thriving childcare center in Etobicoke, Ontario. Her journey as a mother took a life-altering turn when her son Kael was misdiagnosed at 3 months old and later diagnosed with Alagille syndrome. With her husband and daughter, now 24, by her side, she spent years navigating a complicated healthcare system, advocating fiercely and holding on to hope through fear and uncertainty. At age 4, Kael received a life-saving liver transplant. Now 14 and thriving, his journey continues to inspire. Anoush shares her experiences as a Black mother fighting for her child's life while continuing to serve her community. She brings heart, humor, and hard-earned wisdom to every conversation. Anoush, I cannot tell you, I cannot tell you how I felt when I first heard your son's story, your story. And because I considered how you must have felt in the first 3 months postpartum. Instead of excitement and happiness, you must have been racked with worry and doubt. So tell us about your experience as a new mother of a child who, for the first 3 months of his life, was diagnosed as being jaundiced. How did you feel? What was running through your mind when every day you saw him, with that yellowish tinge in the eyes, his skin? How did you feel? What were the doctors saying?
Yeah. So, I mean, basically, you're having this was my second pregnancy, and it was like a beautiful one. It went like it went well. So it wasn't really until he was born, and then, everything was sort of normal. And then at our 3-month check, so the jaundice did go away as normal, and then it came back 3 months. So just getting the news and sort of at first not even understanding what that meant, having sort of the jaundiced tone and the color, and then just like the implications to the liver and bile. So obviously researching and finding out information, and just, I guess, just shock that this is happening to us. Just at that initial time, and then sort of not knowing at that first part what implications like had for us. And so yeah, basically at first was just like shocked and scared because we didn't really know what this meant.
So what did the doctors say was the cause of this intermittent yet seemingly prolonged jaundiced condition? What did
Yeah,
they
so
say?
at first they, when they sort of did the testing and found out, that they assumed that it was this um liver duct issue called biliary atresia. And so biliary atresia, the sort of the solution for that would be a Kasai treatment. So very short, like after we found out that his liver numbers were up, and that his and that like his bilirubin was high, and the doctor will know what I'm meaning, but all of those numbers were elevated. It was kind of like very, very quickly, in a matter of a couple of days, that they said they had to do an emergency Kasai procedure where they would take the intestine and directly attach it to the liver, bypassing all of the ducts. So we were like, well, I mean, obviously, having any kind of major surgery is crazy to even think about, but them just sharing that this really was, it was a 50-50 chance that it would work. It may not even have worked. And so that's kind of what happened, is that we had this, and then shortly after it wasn't working. And then they were like, okay, well, plan B, let's figure something else out. And in the interim, after that didn't work, then they thought that they would test us for Alagille. But we had to wait several months for that to come back, because I think the testing takes long, from what I remember. So we were still sort of working with this Kasai that was not working as it should, and then having to sort of deal with the symptoms of having increased bilirubin in the system. So jaundice, itching,
How did
but that was like
how did
later on.
how did this diagnosis lead to? So you're waiting on the Alagille syndrome results, but how did, tell me that movement? Like, how did this diagnosis lead to recommendation for liver transplantation at Kael's really young age?
So that, basically that conversation for transplant didn't happen till about like 2 years of us sort of going through the motions and trying to manage with like coconut oil and supplements, sort of building up his, because at the time, when we had the Kasai treatment, they told us that if we didn't have this procedure, it would be failure to thrive, and he wouldn't make it past 2 years old, or even like 1 year old at the time. But that he would, because when we were having that conversation when he was around 8 months, they were saying he wouldn't live until 2. So we had to figure out how to do something. And then at that point, we started doing the testing for the liver donor program. But we were still sort of waiting, because it wasn't like he didn't have the classic like bloated belly, because like the ascite, I think it's called ascites. It's a term that, yeah, that basically distended belly. Like he wasn't that bad. It was just the jaundice itching, very like, incessant itching, and then some sort of fat deposits that would appear. So he was stable and we were managing. So it wasn't until, yeah, basically after he turned a year that we had the conversation that he would need a living transplant. And then his dad and like family members went through the process to get tested to see if they were a match. And then it ended up that dad was the match. And then we kind of was just like, because transplant was something that we didn't want to go because of the immunosuppressants. Like it's scary. It's scary to have major surgery, and then obviously they tell you the not the side effects, but like the complications that could arise from this. So we were sort of holding off on transplant, and that's I think why we didn't do it until he was 4, was because we were trying to figure out like home remedies, like herbs and medicines, and obviously Western medicine told us don't do that, but you still kind of try, like, we can fix this, like,
Yes.
we can drink a tea or
Mhm.
or
So the dad was a match.
yes.
And he decided that he would donate.
Yeah, when the time
Part
came.
when the time came, a part eventually, because clearly the teeth and the intinction, all those things weren't working. So
No.
at some point, you all came to the decision that yes, you want Kael to live, and so you're gonna get tested. So that was a match. Was there any other matches in the family?
No, there wasn't. And there wasn't that many people that could fit, like, we had family members, but some were too young. Some were too old, some had like complications, medical. And then to be honest, it was, I think his dad was like, I have to do this. Like it just so happened that it was a match, but he, this is
Yes.
obviously his first child, and it's his son. And he's like, I'm gonna do whatever it takes. Like there's no question, I'm gonna stop drinking, I'm gonna stop smoking, I'm gonna do everything, like everything was like he basically was like, this is like the greatest gift that I could give to my son.
Let me pause there just to
Yeah.
check in with Kael.
Yeah.
Kael, we're having a conversation about you. How are you feeling when you hear these stories? Is it the first time you're hearing these stories?
No, I've heard it many times in the
You've
past.
heard it many times. So how are you feeling tonight, hearing it again?
I mean, just the amount of people here, it makes you a little bit nervous, but at the same time, I feel like I'm gonna get through it. And I mean, it's a little bit scary at the same time because I realized like I wouldn't have lived, and right now, as I'm living right now, I'm working out, I'm strong, I'm eating well. So it's like,
Good.
I don't know, I feel good. I mean, nothing's really
All
going
right.
wrong with me.
Okay.
I feel amazing.
And we are all very happy for that. I just wanted to check in just to, test the temperature and see how you're feeling. So, good thing that you mentioned, you're eating well, you're feeling good, you're active. So, Anoush, would you say that you're a family that has always stayed away from unhealthy processed foods, avoided prescription drugs, if you didn't really need them? Would you say you're that kind of family? And then I have a few more questions to ask you, because that, believe it or not, is a consideration for a lot of families. When they think about a transplant, they're thinking about a lot of drugs, the necessity, including the drugs that will keep you from rejecting the organ. So when you realized that let's call him a baby. I mean, he was a toddler by that time, but still, he's your baby, it's your wash belly. When you realized that your baby was still young and had to have that major surgery, needing a liver, or at least a part of a liver, how did you feel? What was your thinking? Did you have concerns about the cocktail of drugs that he would have to take? Did you decide to, or you just said to yourself, you know what, I'm going to do whatever is necessary? Because, of course, there is the dreaded alternative of doing nothing, right?
Yeah.
So, what did you and Dad decide to do? How did you, what kind of conversations did you have as you agreed on the way forward?
So, and that's, I mean, that's sort of a, a sort of what changed the way that we approached sort of Western medicine and medication. So, we didn't really take Tylenol. Like when we had headaches, we'd sort of lie down. Like it wasn't something where medications and were something that we sort of relied on. Even so, we did change sort of the way that we ate because we had to supplement him with like fats. And so sort of even the way that we prepared food, like we would just have food out and he would just graze and like pick up and like eat whenever he wanted because he just always wanted to eat. But it was healthy foods. It did change the way that we lots of vegetables, lots of fruit, but then lots of like fats, but like healthy fats. So like coconut oil, avocado, like all of those things that, obviously I worked in childcare. So I was sort of on we had dietitians that would vet our menus. So I was always sort of paying attention to healthy food choices. But with sort of entering into this realm of where you were going to have to be like taking medications and being on immunosuppressants for the rest of his life, we were just thinking like you need your immune system. Like we didn't want it to be suppressed. Like we didn't so we were thinking that we would be able to sort of fix this. And then we obviously came to the realization that we should just put his name on the list, the main list, because at this point we weren't. So it was, I think he was, I would say like 5 months before he turned 4 that they put him on the main list. And then we got a call that they had a liver for him. And then sort of, do you want me to go down that route? Because that's the
I wanted to go down that road,
later.
but first, let me ask you about the engagement.
Mm-hmm.
How did you experience patient engagement on behalf of Kael? Is the pediatric health space welcoming?
Yeah.
And we're talking about from when he was, as you said, intermittently jaundiced
Mm-hmm.
and over that prolonged period. Was did you feel as though you were being heard? Did you feel as though you were being engaged, you were being included at every stage of the decision making? And if you did, what did this inclusion look like? How did you feel? How did you experience parental engagement?
Yeah.
Patient.
So I think because we were at Sick Kids in Toronto uh and sort of the liver team and the liver specialists that were on that team, like, or the GI specialists, they were like amazing. And I think because they shared a lot of information and sort of helped us through this process, that it made it a little bit easier to accept whenever they told us that we had to do something. Um, the yeah, it was everybody was supportive. It was funny because some of the nurses that were there, I had sort of known or met from before. So we kind of like knew them and they would say, "Oh, I remember you." And so it was kind of like a family because we were there so regularly. And you kind of knew the nurses, you knew the doctors, and they did help, I guess, lessen the fears of that. This was, once we knew that we had to do it, you know, so obviously there's hesitation and we're like figuring out, yeah, we're going to fix it. We're going to fix it. He doesn't need it. They're wrong. They were wrong before. So that was a little bit, you know, a bit of mistrust in the beginning. After we got the Alagille diagnosis, because it was kind of like, we went through all of that and it was wrong. Like, should we still trust you? Should we still believe what you're saying? And like, we didn't get a second opinion, so to speak. So that was initially, but we got over that once we saw that, you know, they finally got it.
How did you get over that? How did the medical and the clinical team assuage your fears? Because again, there was, so how did that happen? Was it communication? What exactly? How could you describe that process to
Not
help
really.
you and your husband get over it?
Yeah, it was kind of just like looking into ourselves and not wanting to place blame, because we didn't really we're like, oh, sorry. It wasn't like, you know, and I guess our personalities too, we're not sort of ones to ask a lot of questions and like challenge. Like I don't really, so I think that once they kind of said that, oh, we had a misdiagnosis, we kind of just was like, there was so much going on, so we didn't even focus on like pointing fingers. It was more like, okay, now we have the answer. We didn't have it before. Now let's just move on, because it was, you know, it's traumatic enough as it is.
Yeah.
And those questions of like, why is this happening to us? What did we do wrong? You know, that those little fleeting thoughts that you know, that doesn't, now it's like, it made us so strong. Like, it made us stronger. I don't think of it as sort of a negative thing at all. And because it went so well. I think.
Okay, let's talk about what went well. So you were told that your husband is a match.
Yeah.
You went in to, I guess, get all the work done to make sure that, you know, everything will go well. And then what happened? Tell me about your transplant journey.
Yeah. So went to the testings, and now, you know, we're a couple months before we actually got the call. They had said, you know, we're going to just put you on the list. You know, even though dad's a donor and is a match, let's just do it just in case. And at that time, I feel like they maybe knew something because so it was, I want to say a couple months, but I feel like now it's a couple of weeks. But anyways, neither here nor there. So the Friday we had went for like a checkup, a regular checkup. We go for blood, you know, every couple of months we go and draw blood. And so we had a meeting on the Friday, and then the Sunday, or like they had their meeting, and then on the Sunday we got a call, and they were like, oh, we have a liver for you. And I was just like, oh no, that's a mistake. And it was literally, I was on the phone, I'm right here in the kitchen. I was like, no, that's a mistake. Dad's a donor. He's a living donor. We're in that program. We don't actually need it. Like, and then they said, no, we have a report here, that we actually, you do need it, because on the Friday they had a meeting, did some follow-up testing, and realized that the ducts that were, well, because remember they did the Kasai, so the duct that was attached to the liver at the time, they can't use it for a partial. So they needed a full liver with everything attached. So that, him being a candidate for that, they couldn't do it anymore, because I think maybe whatever the intestine that's attached to the liver that was functioning well for the last 4 years, or 3.5 rather, would not sustain
And your
was the
husband
assumption.
and your husband couldn't give the whole liver. So
No, exactly, because that he just not a
yes,
candidate
that would be
anymore.
bad.
So having that information, just like, you know, I think it was like in the morning, and then they said that we had to come tomorrow, the next morning, at like 6 o'clock in the morning, or 5, probably even earlier than that, to do the transplant. Like, the call before. So we were like, I guess this is like, okay. And you're kind of just in shock, packing the bag, trying to get everything organized because we're going tomorrow because there's a liver available and a full liver. So, and also the ramifications to that. So like he's 4 years old, you know, fairly small. So in order for him to have a liver, it definitely would have been a child that was younger that had passed. So a family was grieving and you sort of, you know, gave that gift. So that's going through my mind too. And the emotions, because like now that whole thing as the gift of life is that, and this was another thing too, is that when we were having this conversation about being donors, there was such stigma attached to putting your name on a donor list for when you do pass and to have your organs. Like a lot of people don't do that. It's not even something you want to die with whatever you're with your organs. And even my mom was just like, there's no, I'm not going to cut up and you're not going to, but she would have for her, you know, for her nephew, for her grandson. But it's not even that conversation when you're talking to people and like, oh, you're going to give an organ to somebody else? Like, so obviously now everybody in our circle and everybody that we're involved with are now living are now donor, like, and will donate their parts. So that was, you know, but that piece, yes, ready to go. And went to the hospital and I think it was like, I don't know, 10 hours or 12, like a very long, it was all day. And you know, sort of waiting at the hospital and yeah, praying and just staying positive that everything went well. And then basically that night he went into ICU and they said, you know, he's going to be here for a couple days. So we'll just monitor. You can go home, you can rest. And the funny part of this was my mom said, you're not going anywhere. You're staying there. You're not going to go home and rest. And, you know, obviously she said it in Jamaican. She said, you know, go nowhere. Sleep. I don't know where you're going to sleep. If you're going to sleep downstairs, sleep in the room, bed there. You're not leaving him. And at
Well,
2
that
o'clock in
sounds
the
just
morning,
about right.
yeah, you're not. No. Go home. Make go home. Go home and pack a bag, and you come back. So I stayed. And lo and behold, at 2 o'clock in the morning, I got a call because they give you like a pager that they're ready to move him to a room because, so what was the stipulation was that you stay in ICU until like until potentially the child pulls out the tubes or they're, you know, they're miraculously better or if they're wiggling around because, so basically that's what he did is that he woke up and pulled out his tubes and now he was breathing on his own. And they were like, okay, well, he's ready. And at 2 o'clock in the morning, we went and got a room and I called my husband and I was just like, he's ready to be moved. And they had said 2 to 3 days in ICU. So he was basically, and that whole process after transplant, like one day he was already walking and moving around and blowing bubbles and they had said it would take a week. So everything that they were saying would take longer. It was sort of like he was meant to have this liver and just everything went perfectly. And we were, I think, I can't recall if by less than a week, I think my husband would have to think, but we weren't there for the 2 to 3 weeks that they said that we were going to be. And then obviously home with homework. But yeah, so like after that, and then just like the maintenance of being now I'm a nurse.
Yeah, that's basically what it turns out to be most of the times for the mother,
Yeah.
especially. Kael, you're hearing this story again for the umpteenth time. But when did you hear it for the first time? Do you remember when? How old were you around?
Maybe like grade 4 or 5. I'm not sure because my friends, it's like I go to the pool because there's a pool near my house, and I would take off my shirt because like why wouldn't you take off your shirt in the pool? And then they would always
Yeah.
see a cut on my stomach, and then I would kind of lie to them because I felt scared to actually tell them what happened. So I would say, "Oh, it was like something happened." Like I would say I got a shark bite or something like that. Yeah, it's a lie because like it looked like a shark bite. But then like
Okay.
my close friends, I would tell the truth because like they're close friends, so they wouldn't really. Because
Yeah.
when you're in grade 5 or 4 or something like that, like you're pretty like you're scared of what people are gonna think about you. But now when I
Naturally.
get older, now when I get old, all my friends know it, so like I don't really care.
So tell me something. They don't care. You don't care. But how is your health now that you have had the transplant? Are you feeling really good all the time? Are you tired sometime? How do you feel? How does your
I
body feel?
mean, sometimes I get like mood swings where I'm like, I mean that's regular with everybody. But like these past like few years and stuff, I've been feeling like very good, and I just I told you already, I've been working out, eating healthy, active, playing basketball at a high level, stuff like that. And I just feel like I can't be stopped, but I don't want to jinx that. So,
You're
you know,
invincible, Kael. You're invincible. So I like to hear that. I like to hear that. So keep it up. Um, your daily, in terms of your daily routine, how do you feel about the medication that you have to take?
that's one that I've been thinking for a while. I mean, well, I wake up, brush my teeth, do all that stuff, and then I come down and a medication. So I take my medication, but the thing that I don't get, because me and my mom have been talking about it, and it's like, I don't know, it's weird because I feel like the liver is a part of me now. So, I mean, I'm obviously going to take it till the rest of my life, but there's a part of me that's just like, do I really need to take it? Because, like, I feel like I know, yeah, obviously, yes, I'm going to take it because if I don't, there's a chance that I could die. But there's a part of me in the
Yeah.
back of my head that's like, do I really have to? Because, I mean, I've been healthy all my life, and I feel like it's a part of me. So there's just like a uncertainty if I should take it still. I mean, yes, I'm going to still take it because I have to, and if I don't, I'll get in trouble. But there's just a little
Yeah,
part of my head that's like,
I get it. I
is
get
it
it,
really
Kael.
necessary?
I take my medication most of the times, and it's the same thing I'm thinking. What, wouldn't I still live if I didn't take it? But then I don't
Mm-hmm.
want to find out,
Mm-hmm. Yeah.
right? I don't want to find out what would happen if I stop taking it fully. So yeah, I get you. I get you. But it's something that, it comes with the good. So if you're gonna
Mm-hmm.
get an organ, it's quite miraculous, right? To take an organ that belongs to someone else or belonged to
Mm-hmm.
someone else and put it in your own body. So yeah, you do need the medication to help that organ to stay where it should be, and of course for you to keep in good health. So
Mm-hmm.
mama, let me get
Mm-hmm.
back to you now. Your boy is 14, going on 15. How do you feel having gone through this process? What was the role? And I guess this question is for both Kael and you.
Mm-hmm.
What was the role of faith throughout this process? Let me start with Kael. Kael, you go to school. I believe
Mm-hmm.
you go to Catholic school.
Mm-hmm.
Are you a person of faith, or, it just doesn't feature in your life much? How would you
No,
describe yourself?
I would think I'm a person of faith, and that I put God first and all that stuff before like a lot of things. Because I mean, he's God. How would I not?
Why not? Why not? And so does this help you, or does it even impact your life as a transplant recipient, a liver transplant recipient? Does it influence faith is separate and apart?
No, I think it's all together, and I like put all wishes to God that like He helped me through this,
Mm.
and it's just He's a part of me, so I'll always keep Him by my side, and it's like I feel like He's the reason why I'm living right now, and I have faith in Him and all that stuff. And if He
Oh,
wasn't by my side, who would have known what happened?
oh, Kael, Kael, Kael. You give me goosebumps. Goosebumps, Kael. Thank you so very much for that. And Anoush, what are your thoughts on that bridge?
Yeah. And I think so that was that, you know, serendipity or like coincidence or or faith, um, uh, of the term was just like it was meant to be. And I feel like all of them, even though we had such sort of had to deal with like pretty traumatic process, it only made us stronger. It sort of, obviously brought us closer, and it educated us, and it educated, the people around us. Um, and I think it was just, I kind of feel like I wish I did more. I mean, it's not too late, but do, for this sort of transplant or the transplant journey, and, spoke up a little bit more about our story throughout, well, while he was younger, to just make it more of an impact, I think, on other people's lives. I think that might be the ultimate, sort of end result. But yes, having faith and just knowing that we would get through this and having a positive attitude, but definitely, yeah, like fearful and trusting, because that's another thing too. Like so many things, bad things happen to like good people all the time. But then you always think that there's a reason for it, and then sometimes there isn't a reason. So it's hard to navigate that when bad things happen, because you're like, um, it's a test. It definitely was a sort of a test, and sticking through and staying positive and knowing that we would be okay. Um, yeah, you kind of just hope, just hope that everything's gonna work out. And it did. So we didn't we
Said
didn't, I
bad
guess,
things.
falter.
You said bad things happen to good people all the time.
Hmm.
And so that prompts me to ask, was there any blame and shame happening on either side of the family regarding, why did this happen to Kael? And, you know where I'm going with this
Hmm.
question.
Yeah.
So what
So
what was that like in the family? Because good things happen, bad things happen to good people.
yeah, but good
But
thing.
we are also human, and sometimes we say
Hmm.
things that are, so what did that look like?
So initially, like it was really just like, and even, my husband, because he's of European descent, and one of the things with Alagille is that they did say that it was a hereditary, um sort of, or a chromosome thing. Like there was, it could be like a chromosome, but then also like hereditary had something to do with it. But then once you kind of see the lineage, like I'm Jamaican, and I have like my grandfather is of European descent. So it could have been his Polish descent. It could have been my European descent from, so you can't really blame, but it was a conversation where it came up to where, for a second, where we were like, oh, hereditary, could it be your family? Could it be my family? I mean, it could be my family. It could not just because you're, of Eastern European doesn't mean that you're the one, because there's lineage. So it was very, very flippant, kind of like, oh, but nothing to dwell on. And yeah, no, no placing blame, but I know that this, yeah, definitely could have happened, but I think it's just because we were in it together. Yeah, we were just in it together. So there wasn't any sort of issues with,
Wonderful,
yeah,
wonderful.
yeah.
I I'm not sure if you know this, but I study mothers and their engagement with professionals, whether it's education professionals or health professionals. So I'm
Mhm,
always intrigued by the mother's experience, mothering, motherhood.
mhm, mhm.
So tell me about your own mental and emotional state
Yeah.
before the transplant, during the transplant,
Oh,
post transplant. So throughout the entire arc,
yeah.
what was your mental and emotional and even physical state? Did you lose weight? Did you put on weight?
Well, I mean, it's funny that you do say that because so at first you don't realize because you're just going through the motions. So um I don't want to, yeah, being a Black, strong, independent woman and having to sort of do a lot on my own through even from like 8 years old, you know, being a latchkey kid, my mom working, I'm home alone, spending a lot of time spending a lot of time alone and spending a lot of time making um fun for myself. And then even like, you're not really you don't get as much financial support from my family for like college and then sort of post-secondary and even like living on my own and sort of doing everything alone for a good part of my life and then doing this now with somebody but still having sort of that background of like I'm going to do this, I'm going to handle it, you don't really have to worry about much, I've got it, I'm going to do it, I'm going to do the research, I'm going to so taking everything on and then sort of still smiling but then crying quietly at night or sort of internally just sharing information, like not sharing how I feel because you don't want to burden anybody else, you don't want to bother anybody else, so staying strong when I didn't have all the answers, and even sharing with like my husband, like sometimes when you talk about it he's a little bit more emotional than I am, so i'm I'm the one who's supporting everybody's emotions and then sort of mine. And then also having to deal with my daughter, right? So like, my daughter at the time was 10 years old, 10, 11, 12, 13. So just still trying to make sure that she was okay in her formative years. Um, so yes, being like superwoman, so to speak, and just doing it and not complaining. I was fine, but I realized okay, so I would wake up every morning with like body aches and stiffness for a good two years. Um, and I just attribute it to like, sort of lack of exercise and all of that stuff. And then I kind of did some more research just about stress. And sort of and I didn't realize until after. So when we got the call for the transplant and he had his transplant, the morning that I woke up, and I'm sleeping in the hospital. So the morning that I woke up with no pain for the first time in 2 years. And so I said this to my husband. I was just like, my body doesn't hurt. um, we kind of, sort of did research and blah, 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 and Google, and it was like, yes, that basically I was just holding all of this stress. And and it was manifesting in my body when I woke up every morning. So when that went away, and because it went away the next day, I was just like, oh, stress really was a thing that a lot of sort of women of color and mental health, like you don't tell anybody that you're sad, you you don't share that you're weak, I guess, in a sense. You don't cry. um And that might, it's not necessarily for everybody, but that's definitely like, in sort of emotions weren't something that you let show. And then sort of being in a partnership with someone whose emotions were like worn on their sleeve. But it's funny too, is like there was one time where I broke down and my husband was like strong. And then that's when I was just like, oh geez, like I can break down. Like that was like an eye opener. Is that when I am weak, like he will pick it up. But I just never gave him that chance to take that role. Cause like I remember I broke down one time and he was like, nope, we got this. And he, sort of brought me back. And that was the first time where I was like, I felt that I didn't have to do it on my own because I had, and that was just me wanting to take to do everything because I've always done it. And even now, like I'm still trying to delegate. It's difficult.
That's a part of the British stoic, the British upper
Yeah.
lip that we are brought up. That's the colonial legacy that we inherited. I
Yeah,
have
strong
one,
shoulders.
I have one question for you, and one more question. Well, it may be a bit more longer than one, but I can't close the interview without asking about race and racism. So I'm asking, did you encounter racism at any time during the entire process over, let's say over the 4 or 5 year period of the first, and how did it appear? How did this racism in health spaces appear? Was it overt? Was it in your face? Was it subtle? Perhaps just microaggressions? Tell me about that.
We didn't actually. We didn't experience anything of that sort of racism. But what I can speak to is sort of the stigma attached, or at least for myself, uh, uh, of like believing or trusting Western medicine in a sense of like, and then also the stigma attached to transplant and like sort of being a donor. Like I sort of touched on this before, where I think like in the Black culture, it's not something that people talk about in a sense of donating your organs. Yeah, it's kind of like that piece to me definitely had some cultural connotation to where you just don't do that. Like um and it wasn't even something. So if it didn't, and I can say this now, like potentially if my son didn't have needed a liver, I might not have put my name on a donor list because it's kind of like somebody else's problem. It's not my problem. As much as you want to help, but it's like, and obviously death, nobody wants to think about death. But when you're faced with it happening potentially to your child, you do that part of your brain switches on to be like, yeah, no, I have to do it. So that, yeah, we didn't experience racism, but there was some like apprehension to sort of going this route, I guess. Yeah, I think I answered that.
I think you did. I think you
Yeah.
did. And I thank you for being so forthright and, willing to be vulnerable to answer these questions, because sometimes they can be a little bit intrusive, because some things that you don't necessarily speak out loud about. And so I thank you for this, and I thank Kael for his contribution. Kael, is there anything else that you want to tell us that we don't know, that a 14-year-old young man wants to, let us know about transplantation, that pediatric transplantation journey, because you're going through it now as a young man, a pre young man, You're in the age where you're not fully a man, but you're definitely not a
Thanks,
kid,
yes.
right?
Mhm. I mean, I just want like if you're going through anything, I would say put everything into God, to be honest. I know I'm talking about God a lot, but like, it's just something that like I stand by. So like for me, since I was going through it, I would just, you know, put faith into him. And then also if anybody else is going through something, he has a plan for you in the end. I know like it might not seem well, like, oh, you broke a bone in your body, then oh, maybe it could have been worse if you landed a different way. So you should at least be blessed that like because um I was watching some video about this basketball player named Kyrie Irving and that he broke his ACL, and I saw a video of somebody talking about how when he went to shoot the free throws, he was saying thank you God. And I was thinking in my head that like what if he went on a plane to fly somewhere else and the plane crashed, or he was walking and he got shot or something like that. So there's always like a hidden meaning in all things. There's it's just fun to see that.
I love how you're thinking, Kael. I love how you're thinking. Um, keep on doing that. Keep on philosophizing. Keep on thinking deeply about life and the role that, faith plays. And because everything comes together, right? It doesn't
Mhm.
stand in silos. So don't feel as though you need to apologize for
Mhm.
your faith. Okay?
Mhm.
We are
Mhm.
just now at the end of this part of the in terms of the interview. And now I'm going to ask Dr. Thame to unmute because now we are going into the Q&A portion of the webinar. But first, let me introduce Dr. Kirk Thame. Dr. Kirk Thame is a pediatric gastroenterologist and division chief in the Department of Pediatrics at Louisiana State University Health Sciences Center in New Orleans. His clinical focus is gastrointestinal motility. He earned his medical degree from the University of the West Indies, Mona campus, in Kingston, Jamaica, and returned to lecture there for over 6 years after completing postgraduate training in the United States. In addition to his academic roles, he is the Vice Chair of Community Engagement and Health Equity for the Department of Pediatrics. So, Dr. Thame, welcome.
Thank you.
You have been listening to Anoush and Kael. You have been listening to me doing my best to pronounce the word Alagille syndrome.
Mhm.
What is this Alagille syndrome? Who does it
So,
affect and how does it affect the body?
yeah, so the word syndrome we use when it's a collection of symptoms more than, like a disease. So it's a congenital condition, and it is, as we've mentioned before, Mom mentioned that it's a genetic disorder. So there's several genes that can be affected, and then they give rise to the same thing. The main thing that it causes in the liver is that the bile ducts, you don't have enough of the bile ducts, which are the tubes that drain bile and other things from the liver, so waste really from the liver. So you don't have enough of those. It can look a lot like biliary atresia. It's one of the things that we're taught that, to differentiate the two because the treatment is very different. You want Kasai for biliary atresia, you don't want that for Alagilles. But beyond the liver, it can also affect almost any organ of the body. The heart, the kidneys, even the vertebrae, so everybody's presentation is different, but you can have several other abnormalities in the body in addition to the liver.
So it is not then malpractice. It's not a huge mistake then to have first been diagnosed with biliary
Pediatric, yes.
atresia, right? Okay.
Yeah,
Because
yeah.
we often we wonder, sometimes, what happened there. So it's
Yeah.
good to know.
It's also a little bit hard for me to try to figure out, we're 14 years old?
Mhm.
Yeah, like 14 years ago, that would have been early 2000s. Yeah, I mean, yeah. The further back you go is the more difficult it is. But by then, I mean, we still knew the differences because, that was well after I finished training. And I was taught it during training. So it's something that is tricky. I'm not sure what the details were, in terms of what led them to think of biliary atresia. Was it the pathology or the investigations that they did at the time?
Yeah, and I think just because he was 3 months old, so I think
Yeah.
it was more an emergency type of decision, and then sort of now an afterthought to like, oh,
Yeah.
this could be something else. So and I think that was sort of the piece because the allergial testing didn't come till a bit after.
Right. Yeah.
Yeah.
And especially back then, because it's really genetic testing, then back then the turnaround time was longer.
Mhm.
As well as for Kasai procedures for biliary atresia, you want to do that. I mean, people are now saying 4 weeks, 6 weeks or
Mm.
before, because the earlier you do the Kasai, the better the
Mhm.
outcome.
Mhm.
3 months now would it be considered late?
Mhm.
Back then it was like borderline okay, which is why they probably had that kind of urgency.
Mhm. Mhm. And
I
so
see.
with the allergial, it does also affect a little bit. We do cardiac testing too, because they just want to monitor um like the heart to see if there's anything with that. And then also we just did an MRI recently because they want to check if there's anything in like the brain or so they're still sort of doing testing in regards to allergial for certain things as he's getting older. But other than that, it's been fine.
Mm. Let me ask you this. And again, forgive me because social sciences is my thing. But why would he need why the adult partial liver wasn't enough and Kael would have needed the full liver? Is it
Yeah.
because of the ducts or what?
I
Sorry,
think,
go ahead.
yeah, I think that was because in his case he had the Kasai before, correct?
Mm.
Yeah. So with the Kasai, you remove the duct. So then there'd be no duct to connect to, I guess. But also the other consideration is just size, because you need a certain mass of liver, depending on the size of the person, adult or adult or child. So if they're not, I mean, he was small, he would have been able to do a partial liver. But at a certain age and size, then you need a full.
Mm-hmm.
Do you have any questions for Anoush, or can I ask one more question before you ask your question?
You can go ahead.
Okay, so are there differences in care? Again, I am always looking at the work that mothers have to do. And that, yes, I know fathers do some of it, but we all know the mother load. The mother load is on the mothers. So in terms of care, is it different care of the transplant recipient? Is it much different for a pediatric transplantation versus an adult transplantation? And I know that the adult can take care of themselves, but I was just wondering, in terms of the liver itself, in terms of the transplant process, is it different between, a young person in terms of pediatric versus an adult transplantation?
Yeah, so of course I'm not a transplant surgeon or even a hepatologist, but the size is what is the biggest thing, I would think. Because if you think of what you're doing is that you're connecting blood vessels as well as bile ducts, and these things are like skinny. The smaller you are, the smaller the ducts are. And you have to sew those together. And so, the common type of problems that you get after surgery can be that you can have a stricture, so a narrowing down of the bile duct, for instance, that then causes a blockage of flow. And sometimes you'll have to go up, dilate that. Or you can have damage to the hepatic artery that supplies the liver. And then if the blood isn't getting through, it will damage parts of the liver or the bile duct that the artery supplied. And so that can compromise a transplant sometimes where, like the size, the match, everything is fine, but technically either of those things go wrong and then it damages the transplant, or it is an ongoing problem that needs to be kind of monitored and treated.
Okay, thank you. Thank you. Do you have any questions for Anoush and Kael?
Questions? No. But it sounds like they had a relatively good, if not great, experience. I mean, with the transplant portion of things, that things went smoothly, which sometimes it does. Yeah, and that's fortunate.
Yeah.
Yeah.
That's
Definitely
good.
felt lucky. And then I do want to add, so I'm just thinking back and I remember you were asking something about the medications and like the immunosuppressants that he has to take. And we've actually found that he hasn't really gotten sick as much as we thought that he would. That like however the immune system works, like it's working well even with the immunosuppressants. Where the thing that he does get a lot is like gastro, like vomiting, not vomiting, like diarrhea. And it was kind of like every time we would go to the hospital, it would be like he'd come back and he'd be just more susceptible, I think, to that virus that causes diarrhea more than anything. Like he got COVID, he wasn't even sick for a week. It was like, you're thinking they talk about the immunosuppressants and uh immunocompromised, and like I can count on my hand the times that he's been sick. So we were happy to learn that 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 he didn't get as sick as we thought. We thought he'd be like sick every day and then basically just like a walking germ magnet.
Yeah. It's something I've discussed with patients as well, because we use some drugs even in like inflammatory bowel disease that are immunosuppressants. Not as high doses and that you would do, say, for a transplant, and then not even the same medications. But I think people think that when you say immunosuppressant, it means that all of your immune system goes to zero, which is not the case. It's just that it's weaker, as well as, the further you go out from your transplant, the immunosuppressive dose also decreases. So you're less and less immunosuppressed, but you really just need to get it enough to prevent rejection, but not really to obliterate their entire. And so I've told people when we're using other medicines that, even the transplant patients who we see, we don't see them in hospital all the time. They're coming back with infections. It's not a common thing.
Okay. Yeah. That's helpful to know.
That's good. We at this time, I'm gonna ask MC Devron, are there any questions from the audience? Dr. Mucci, do you have any responses that you'd like to give at this point? Or questions I should say.
Thank you very much. Thank you for sharing this amazing story, and thank you for kind of letting us to know you too, and three amazing people with her husband. I'm Hungarian, so very close to Poland, and Hungarians and then Poles are uh, quite close to each other. So it was also good to hear that part. And I just had a few thoughts. Certainly, you were mentioning the role of faith and believing and hoping that support is coming. I think it is also important what you were talking about throughout, that while faith and believing and hoping is essential, you also do your part. And so
Mhm.
that together will go and will take you where you need to. And I think it is important. I think this whole discussion around the medication and the side effects. I had a question whether there is any symptoms, or I had a question I didn't ask, any symptoms that limits you, and then you mentioned these stomach related issues. Um, but it's important to talk because many people have major concerns about these medications. And many would think what you said, that, well, you thought that the immune system would be wiped out. And it's important to see this young gentleman who is taking those medications and doing well. And
Mhm.
what you said about talking about this, and this is why it's so beautiful to hear this and making this available through this webinar, so that other people can hear both the transplant side, that you received the organ. It's a big thing, but you can get through and you can live a good life. And also the other side you mentioned about the donation, either living or after our death, that our organs are there. And yes, many believe that we need to go as we came, but also there is this important thing that we can help others, we can save lives with those organs. And if you think what you said, that at the time that Kael got the transplant, another family, another person had to give that up. And somehow this is still in the kind of the things of the world, and eventually I think it comes to a balance. So I think it is important. And my question that I asked in the chat was really about how you think that uh, we as a program with CARM and others, the CDTRP, can help people to reconcile these tension, these concerns about the Western medicine, the ways, whether that's a surgery, whether the medications, and how to balance that with the more traditional ways of healing and well-being.
You're asking
Yeah,
for
I'm
my
asking
input?
you because this is
Yeah,
this is one of the mission of CARM as well. With
yeah.
CARM, we are going for these cutting edge genetic treatments, other treatments, and people are frequently scared about this. But
Hmm.
if people are scared, it means that they may not want that treatment, and it means that they are not getting better necessarily.
Right, right. And I think it's just like sharing and doing stuff like this and reaching out to people who've experienced it, because like I said, if I didn't experience it, I probably would be like, somebody else's problem. Like it's not something that and then even too with the immunosuppressants, if I didn't experience it, then I wouldn't know that it's not that bad. That it actually, and like he only had one episode of rejection, and that was like very shortly, and it was because I think he was like sick, but then also like other things that had happened. So, and then the rejection, that's another thing too, is like we, people talk about rejection and you read about rejection, but you don't actually know that it's not actually that your body just rejects the organ. It was just basically he had a fever and his numbers were elevated, and he went on, obviously steroids. I think prednisone, I think, or something, like some other, like a cocktail, and it was over with and it was fine. And obviously we don't want that to happen again, but there's so much, yeah, there's so much, um I guess, like, yeah, the things that people are unsure of, and it's scary, but you kind of have to hear somebody's story that they're saying it's okay. It's okay to have these questions. And it's okay to, ask these yeah, that's what I just said. Ask these questions, and share your story. I think that's the main thing, because people can relate to an actual person saying it'll be okay, and that we're sort of through it. And like how he said, he's strong. He works out. He didn't tell you he plays video games, but yeah. Everything. Loves God, works out, and strong.
Listen,
But
what did I say, Anoush, about leave some things unsaid? Okay, it's his story, and he told me his version, and we believe his version, right? All
love
of
it.
us
No, I
believe
love
his
it.
version.
Yeah.
All of us.
Maybe one
So
more
it's really just
question. Obviously, this condition can only be diagnosed through genetic testing. And
Mhm.
increasingly, we have tools that can do genetic testing much more quickly, precisely, than even 10, 15 years ago. But not everybody is happy. Not everybody feels that genetic testing is safe. Did you have any concern yourself about that at the time? That what do people do with that information? Is that something that, or you never had any concern or second thought?
No, not really. It just we said I think we kind of um didn't know much about it to even like question it. It was just like this is something that they had to do, and you kind of went through it. So there wasn't really because I think it was just like, blood work. So it wasn't obviously the apprehension of the results. That's a little, scary because you don't know what it's going to be. Um, but yeah, for the most part, no, there wasn't anything like that in regards to the testing, just um, the results.
Thank you.
I have a question for Dr. Thame. Considering that you have worked in the great United States of America, and you have worked in Jamaica, I guess my question is, how would a condition like this or a syndrome be treated or be discovered or be handled in Jamaica?
Well, in similar ways, I mean, for allergies, you often have enough of the physical features as well as the liver biopsy, um, you know, to make the diagnosis. So when I was home for that 6.5 years, I think we diagnosed like 3 patients with Alagille syndrome of, you know, different years. Even, most were already older children. But we're able to make the diagnosis just by those symptoms. Um, and biliary atresia as well, there's several tests that you can do, including biopsy as well. Um, the more patients people see, the more for instance, at home, our pathologists are general pathologists. There's no pediatric pathologists. And in everything medical, the more volume you see, the more variance that you see as well, is the more adept you are to making the diagnosis or tricky diagnosis or suspecting, what looks like something but could be something else. So it's, say maybe a little bit more difficult at home in some ways. We don't have the gene testing, for instance. That's something that we'd have to send to the US for. But then that's also a possibility in terms of it's accessible. So a little bit more difficult, but still possible for these disorders. There are other disorders that you can only do the gene testing for, that look similar in terms of the jaundice and the liver disease, and that you'd have to, do that send out test. But that's become so sophisticated that it's like one blood sample or swab of the mouth, and you can get all that information.
I ask this question because when we look at patients who are migrants from Jamaica and their expectations, or let us call it the lack of expectations, because of what is available in Jamaica. And it's I hear you say, send it abroad, send it out. But every time you send something out, we're talking about serious amount of cash
Yeah.
that the patient has to pay for because there's no universal health care in Jamaica. So that is why it occurred to me, what would happen to a pediatric patient? And we're just talking about pediatric patients here only because that's what we're dealing with today. Next week, next month, on the 22nd of November, when we have Dr. Mills, he will be peppered with questions for the adult patient. But since you are here, what happens to a patient? And Jamal, I see you. But I'm just, age. If I don't ask the question now, who knows what's gonna happen to it. So MC, don't laugh at me. So the question is, what would happen to a patient like Anoush in Jamaica?
Right. So if the treatment for Alagille syndrome is, supportive. Usually you don't need a liver transplant early on. You may need it if things progress. Itching, just bad itching is often an indication for it. But let's say he got the correct diagnosis from the start, it would be supportive type treatments. Some things in terms of medication would be more difficult to get, like the fat soluble vitamins that you have to take because you're not absorbing it well, because of the cholestasis. But otherwise fine. For the biliary atresia patients, when I was working there, the sad reality was that you knew that that child was going to die. Um, Maybe not right now, but somewhere along the line, because they always end up needing a transplant. Be it, it's just a matter of, is it going to be in infancy, in childhood, or late childhood? But the degree, this disease, even with a Kasai, is still progressive enough that at some time they'll need it. And at the time, there was just nobody doing transplants in Jamaica. And to have, in America, some people got lucky in just appearing at a hospital and saying, hey, my child has jaundice, and they would then transplant. Those days are gone, long gone. And so the good news is that Jamaica has started to do liver transplants for children in participation with Mike May Help Me. I think it's a group from Delaware. But the pediatric surgeon from Jamaica went up, worked with them. They came down, had him do the surgery, with them and their ICU team, because you also need post-op care as well.
Yes.
That's intense right after. But yeah, they've done a few, and so it's not so much, well, a death sentence now, at least there's hope. And I mean that is, when people talk about global health, health equity and the like, I mean that really should be the direction that we're going in, to make, each country be able to do as much as they can. And it means people who can and have the experience teaching people who don't.
I hear you. I hear you. I'm handing it over now to MC.
Don't forget
Thank you very
Jamal.
much. Yes, MC is gonna take it over from this
Okay.
point.
Yes, thank you so much. So we'll have the rest of the Q&A session. There are a few people who sent questions anonymously, but we'll start with Jamal because you've had your hand raised for a while.
Thank you. Thank you. Good evening, everyone, or good morning or good afternoon, depending on where you're tuning in from. I'm tuning in from the Peel region in the GTA. Thank you so much to the organizers for this. And then, of course, Mrs. Bennett and Kael, for sharing your journey, prospering through Alagille syndrome and, like the liver transplantation before, during, and after it. I have two questions, three if time permits. The first question I had was more about school for Kael. So I wanted to know, have you guys ever encountered like any issues about Kael's school and like understanding any accommodations that are needed? And if so, like what was your experience navigating it?
I'm not, for me, not really. I mean, I haven't really experienced like nothing wrong with it. I mean, like, you know, some friends I don't tell about it, but like most of them know that I had a liver transplant and they're like by my side with it, but it doesn't really affect like school in general.
So a little bit, he probably doesn't really remember much, but he did miss a lot of school, for like, you know, sort of not a lot, but half days, full days to go for like blood work and stuff. But then he also, when he was in grade 1, so like 6 years old, was diagnosed with ADHD. So that sort of added a little bit to his school life and like a little bit of struggles for, you know, several years, and was on medication for ADHD for a short period of time. But then sort of just as with anything neurodivergence, you get older, you learn how to manage, and now so but it wasn't transplant related, but more just yeah, sort of the ADHD with school. But that's my input.
Thank you. Thank you so much. And then my second question I had was, so I'm board chair of a non-for-profit. It's called Black Donor Saves Lives. And they're currently working on something called a Reclaim series. And the Reclaim series is really like a storytelling initiative that centers like Black voices with their experiences, you know, whether it's about receiving donations, giving donations, supporting their families involved in donations. So whether it's about blood, stem cells, tissues, and like whole organs as well. I really would love to connect with you and your son, you know, to join this series, to share your story, you know, in efforts to, I guess, improve like donation rates among Black communities. I know you mentioned yourself, Anusha, there's a lot of stigma, right, when it comes to that. So that's kind of what the series is supposed to do. So I just want to know, like, how can I make that happen? How can we connect? To, you know, honorariums is provided for the participants, you know, as a token of appreciation. So I don't know, I just wanted to shoot my shot here and ask how we can connect for
Yeah,
that.
no, and that's kind of, I think, in the end result of all of this is like, how does our story help other people? Because I kind of took
Mhm.
for granted how, I guess, poignant our story is. And um yeah, like I'm happy to sort of, you know, share. And I think, you know, Kael's very articulate. um and just from his perspective as like a 14-year-old boy, especially around this time with social media and and just like being stuck on a screen, um is just like talking to people and having people see the humanity of this all. I think we're happy to, yeah.
Okay, I'm happy. Okay.
So
Would you be able to give me your to give me your email maybe? Like you can type it in the chat or I can give you my email, whatever works best for
Like
you.
that will happen through MC. Okay,
Ah,
let's
okay.
yeah,
make that happen through MC.
All
Thank
right.
you.
Thank you, MC.
thanks, Jackie.
All right, thank
Okay.
you. That's all I have for now. Thank you.
No, thank you, Jamal.
Thank you, Jamal. All right, so I'll start with the next few questions that are around the same theme. Um, so they say, in general, some people feel as though if they do sign their card to be an organ donor, the doctors won't try to save them. Is this what you thought before this experience? And then another one was asking, you mentioned the stigma of deceased donation or just donation in general. How did you navigate those conversations with your loved ones when they came up?
Mm.
Were there cultural differences that you had? And were there things that you had to unlearn personally from from that cultural
Mm.
background versus what you're experiencing now?
Mm-hmm. Like at first, definitely it wasn't even a thought. Like it's not even something that you even think about to donate your organs. It's not like, so when we were sort of faced with it and then having the conversations, yes, with like my mom and where you're apprehensive because you don't really think it's necessary. because it just seems like so, yeah, like, I mean, just, it's traumatic to go through that for the body and to even transplant. So, it's hard to say what the turning point was because we needed it. That kind of opened up your eyes to be like, you know, yeah, because we need it, we have to do it. And then now, because we had to do it, we can share it, that it's how important it is. So I don't know how we necessarily, I think it was just talking about it and having the need, because it happened to us. So um it's hard to, yeah, like in that sense, you just did it. We had to, and we just sort of changed our thought process. There wasn't any convincing. It was just like, we have to do it. And then now letting people know that this is something that you should do because it helped us. Like, anybody that knows us would would say, like, would be able, it's kind of like the proof is in the pudding that it worked. Did I answer that?
Yes,
I don't
thank
know if
you.
I answered that fully.
Yes, thank you. Thank you for answering the question.
Mm.
And then the next one is somebody was asking why, like, was there a reason or a backstory where you were a bit more hesitant to try Western medicine as opposed to um, traditional remedies?
Mm. I think because, so, like, you hear stuff about the pharmaceutical companies, big pharma, and, like, blood pressure medication. You don't necessarily need to take blood pressure medication because there's herbs that will do it. And then, like, con it is, like, I guess, in a sense of conspiracy theory around that. And sort of, so having that in the back of your mind of not trusting governments and not trusting sort of the powers that be. So there is some apprehension to, like, if 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 they're really telling the truth. And also, too, going back to, like, the Tuskegee experiments, and, like, even, like, in the States with this, like, all of, or not, no, the Tuskegee, not the syphilis. Remember
That's
when they
Tuskegee. You're
tested?
right.
Yeah, yeah, okay, yeah. So I was right. So, like, and I mean, you know, having that conversation with your peers, and, like, being, a child of the 80s, um and yeah, just sort of mistrust to what governments and what people in power. And I wasn't, like, a staunch, like, marching and parading for things. It was just kind of like in the back of your mind, like, there is a bit of mistrust because of history. Um, and not that I personally experienced this, but just, like, sort of conversations in the world about it sort of lead you to your sort of morals and values a little bit. Um, a little bit. So, yeah, having sort of that, but then obviously quickly dispelling it, because now they did help. So I did, so you had to kind of experience it to then trust it.
Can I ask a follow-up question to Dr. Thame on that note? I am not sure what would be the cultural equivalent in terms of nutrition in New Orleans and the places that you have worked in the States. But surely where there are huge populations of Jamaicans in the States, would you say that this is a big issue in terms of the Black communities, whether from the United States traditionally, or from elsewhere, coming in as an immigrant? Is this wanting to embrace medical solutions, in a thing, or is it that most persons who you see are, you know what, let's get better. We will throw out all thoughts about cultural remedies. What are you seeing?
You see a range, honestly. And sometimes, like the disease doesn't match the stance. It's like so there are people who want medication for everything. And there are people who don't want medications at all. And depending on what it is, if it's migraine headaches, for instance, and you're like, I don't want to take medicine, then you have a very bad headache, you're miserable, some people for days, and then it will stop eventually. It's not something that will kill you, shorten your life, leave you with a disability. There are other things like Crohn's disease in the GI world that if you're not on top of it and you get, disease, strictures, complications of it, you can lose all of your colon, parts of your intestines, you can damage your sphincter so you're not continent. And once those things happen, you can't take it back. And so when you see people who you realize this is somebody who has a severe type of the disease, this is somebody who should be like on the highest medications, hitting all your marks, not slacking at all, and you get resistance, then that becomes frustrating. And it's more frustrating in pediatrics because for adults, like that choice is for you, and you own whatever, you know, happens or doesn't happen because you can't always predict. Sometimes you think somebody's going to do poorly and they don't. But for pediatrics, this is, a parent, a family that is choosing for the child. And, any bad outcome is going to be, in the child's body and it's going to affect the child, not so much the people who made the decision. And that's what's more difficult in pediatrics. If you're thinking, this is really what you're supposed to do, clearly I cannot force you unless it's something life-threatening. But yeah, I mean that's probably the hardest part of my job.
Thank you. Thank you. I always, not worry, but I always wonder, how do you, I don't know if the word is balance, but how do you respond to the cultural versus the mainstream medication and the importance, as you said, if it's life or death, what do you do? But yeah.
And I mean that's what it is. You can only you can give your information. I think also like a degree of humility is also good. We use like sometimes we use herbal medicine. It's basically what it is, packaged in a bottle, but it's herbs. For abdominal pain, for recurrent abdominal pain. There's a lot of truth to Chinese medicine. Acupuncture can help, which we don't have great explanations for. But it really all has to be tempered with, with the whole picture, as well as just with, medications. Like sometimes it works for some people, sometimes it doesn't. And sometimes people are just so hardcore on like no medication that it kind of blinds them to, okay, what I'm doing is not quite working. So I think, honesty and humility on both sides
Yes, yes,
to arrive at like what's best for the person.
yes, I agree. Thank you
Believe,
for
kill, and believe cure.
thank you, MC, for
Believe
letting
killer, believe cure, yes.
All right, there are no more questions. Thank you so much, everyone, for joining us today. Thank you, Anoush and Kael, for sharing your story with us. We're very grateful that you've chosen us to share your story with. These are certainly important conversations to have, just within our communities, but also to make sure that there is change that happens within the healthcare system, in the healthcare field. Um, On that note, our next webinar is going to take place on the 22nd of November, and we'll be joined by Caroline Johnson, who will share her story through her diagnosis with an autoimmune liver disease, her liver transplant, recovery, pain management, as well as her advocacy journey. And you can register for that webinar by scanning this link or by clicking the link that I just added to the chat, the main chat. I've also added a survey link under there, so please fill it out so that we can continually improve these events. Or you could also just scan the QR code that's over here right now. So thank you so much. Have an amazing night and a wonderful weekend.